Hey guys, welcome back to the Pulling Curls podcast. Today on episode 226, we are talking about if you need to deliver on your back. So let's untangle it. Hi, I'm Hilary, a serial overcomplicator. I'm also a nurse, mom to three, and the curly head behind Pulling Curls and the Pregnancy Nurse. This podcast aims to help us stop overcomplicating things and remember how much easier it is to keep things simple. Let's smooth out those snarls with Pregnancy and Parenting Untangled, the Pulling Curls podcast. Before we get started, this episode is sponsored by the online prenatal class for couples. If you are looking to get prepared for birth, and I mean all of birth, because there's a lot to talk about, come join me in the online prenatal class for couples. It truly is the easy way to get prepared for your birth. Okay. Delivering on your back is like a huge deal on the interwebs anymore. And I don't know. I don't see it in patient rooms very much. So it's interesting that it's such a big deal on social media. But I wanted to talk to you about delivering on your back and a few thoughts with it. So the first one is that you need to talk with your provider about this in advance. If it's something that's important to you, something you're considering, something you've even thought over, talk to your provider about how they usually deliver patients. FYI, most providers usually deliver patients on their back for a multitude of reasons. Honestly, in the United States, most people, depending on what hospital you're at, deliver with an epidural, which means they're on the bed, which means a lot of times they're on their back, right? So talk with your provider about what they do, just so they have a heads up if you're thinking about delivering in another position, or so you can talk about like the pros and cons with it. Okay, something that I do not see talked about a lot on social media, especially by physical therapists, is that providers are best at delivering babies when you are on your back. Like, I just think it's so funny that physical therapists come into this saying which way you should push because they don't push with patients in the hospital. So sometimes there's more to the story than just your musculature. But providers are just used to supporting a perineum best when you're on your back. And they say that the worst tears are when you're on your back, and I completely disagree. The worst tears are when you are pushing without any support or guidance to help your perineum stretch. Baby comes out and it just sort of explodes down there. So while I think it's a great idea to take the pressure off of the lowest part of your perineum, I agree with that. There are other considerations for as well. And one of the big ones is that if you have an emergency like a shoulder dystocia, things like that, you then will need to get onto the bed and get onto your back in order to deliver the baby. I was listening to a TikTok somewhere of a labor nurse who was trying to squat to have her baby or stand or something like that. And she then had a dystocia. So the baby's head comes out and then the shoulders get stuck. That's what a dystocia is. And then she had to, with the baby hanging out of her, then get on the bed. And just doing that with the head hanging out of a patient, trying to get them on the bed without hurting the baby or the mom or anyone, just seems very confusing. So when you're talking with a provider about delivering in other positions, that's why they start to get a little bit antsy. Now, there are lots of ways to deliver on your side or, with the bottom of the bed down, or like using the squat bar in the bed so that if for some reason there's an issue, you then just fall back onto your back and then you're in a position very easily that the doctor can use their skills most effectively. I will say most doctors are not trained very well in delivering a baby while the patient is squatting. Because they just don't do that in medical school. So if you want a provider that's going to deliver your baby while you're squatting, that's something you're going to want to talk to them about early on if they're good at it. Because a lot of people are like, well, my doctor should be good at everything. And right, wouldn't it be amazing if we were all great at everything? But hopefully you have a provider who says, you know what? I'm just not great in that position. I'm worried you're going to tear more. I'm worried if we have an issue because your baby looks to be a little bit big that we're not going to be able to get you on the bed. So I just want to tell you those things in advance so that that's something that you can think about as well, because maybe you're just thinking one side angle and you need that provider's guidance to think about both sides of how we're going to deliver the baby. That being said, a lot of times I had patients who were like, oh, I want to do XYZ, different things. Or sometimes they just were like fine pushing on their back. And I would rotate them into positions. We'd rotisserie chicken. We'd use the labor ball to push. We use all these different things. Usually I would try every 3 to 5 pushes to change how they were pushing, move them to the side, use the birthing ball or use the peanut ball, things like that. And then after we've tried like 5 different things, I go, which way did you feel the best in? And they're like, I actually really like just delivering on my back. And I don't know if that's because that's how movies have shown it. And so we're just thinking that like, that's how we're going to deliver, or if it's something else. But anyway, just so you guys know, sometimes people just like delivering on their back. So I want to boil this down to talk with your provider if you think that it's something that you are going to be interested in, but also at the time of delivery when you're pushing and you have all those new feelings, and if you have an epidural or not, push in the position that you feel the most comfortable in, because usually that's the one that they push the best in, or it pushed just as well as the other ones, but they felt more comfortable in that position. So those are my thoughts on delivering on your back. I hope you guys found them helpful. If you guys have comments, come find us on Instagram. I'll have a post about this or a reel. And I'd love to hear what you guys think about delivering on your back, what you've learned from physical therapists or talking with your provider. Stay tuned, because next week we are talking with my friend Winter about being pregnant after a loss. And then the week after that, we are talking about getting 4 hours of sleep and why it's important. So stay tuned. Thanks for joining us on the Pulling Curls podcast today. If you liked today's episode, please consider reviewing, sharing, subscribing. It really helps our podcast grow. Thank you.